Well, good afternoon, everybody. Eric with American Business Systems here. Want to introduce you to our webinar today, How to Earn Six-Figure Income Doing Billing for Doctors. And folks, all that from homes. Let me share with you real quickly about American Business Systems. Been around for 26 years, and goodness gracious, in the next 3 years, they will have turned 30 years old. And it's amazing to see in this day and time that businesses even last more than 5 years, not let alone 26, going on 27 years. So ABS has been around. I've been around with ABS in some capacity with ABS in some form or fashion for the last 13 years. It's just amazing how time does fly, and so I could say I've been with the company for half of its time it's been around. So it's pretty amazing. Again, my name is Eric Auger. Good to have you here. I love being a co-host with you this afternoon. Let me introduce you to the founder, the CEO of American Business Systems. It's Patrick Phillips. Not only Patrick is a great leader here at American Business Systems, he's transferred a lot of that leadership over to Adam Phillips, his son, who is now the president of American Business Systems. Matter of fact, last week, Adam and I did, and it was a week before last, Adam and I did a webinar together. And so it's always good to see this as a family business. And Patrick has done a great job of grooming Adam and the rest of the team. And it's good to know that we're still very, very much active. He's also a bestseller with some books here: How to Reprogram Yourself for Success, The New Thriving Medical Practice, Wake Up, Live the Life You Love, which he was one of the co-authors there, and Cash Crunch to Cash Flow. We can get any of these books on Amazon. Some of these books are very specific for you as an ABS licensee, and we're going to maybe talk about a few of those there. He's also on the editorial board of the Billing and Coding Advantage magazine. That is a magazine that does go out periodically throughout the year, and he's been one of their trusted editorial columnists there in that magazine. And he's also on the advisory board of MERMA. That's the Medical Revenue Management Association of America. And that plays very much importance to you being a part of an association like that through MERMA, because MERMA is the people that actually certify you as a revenue cycle management. So as a certified medical revenue manager, they're the ones that do that. So without any further ado, I'm going to ask Patrick to join me this afternoon. Patrick, good to see you this afternoon. Good to have you.
Yeah, good to see you too. Hey, well, folks, thank you for joining us. Look, I did see that some people actually took the initiative there, Eric, and typed something into the question box. And I see a whole bunch of people, though, that didn't. Adrian, let's see, I see that you had not typed anything in there. Bernadette, I see Chanda. Yeah, okay. And then I see James, Julia, Lords, Melissa. I'm seeing a bunch of people here. Oh, now they're typing something in. See, now they know that it's a live webinar. Yes, it's really live, and I can see when you type something in there. Thank you, Michael, Adrian, Rachel. Okay, good. See, all you got to do is just call them out, Adam. Eric. It's just a matter of making sure they know we know that they're here.
Absolutely. Well, it's good to see you here, and it's good to have the folks here this afternoon. And as I stated there in the beginning, Patrick, this is just a conversation between you and I, and I'll be asking you some questions. I'll be kind of monitoring the questions there. So those that are on the webinar this afternoon, feel free to ask any questions you have. You got the man here. You've got Patrick Phillips. He's still the leading founder of this organization. So if somebody knows the answer or should know the answer, it's going to be Patrick. Now, if he doesn't know the answer, he'll make one up on the spot, won't you, Patrick?
Well, listen, I've got the answers to any question you could possibly ask me because I know how to use that new Google thing.
Oh, the Google. Yeah, there you go.
The Google, right.
And you got some articles here that you wanted to kind of run through on this afternoon before we actually get started in some of this. But Patrick, we've been in this pandemic. This has been a crazy year. The whole idea of starting businesses. Should we do it? Should we not do it? I think there's some legitimacy of thinking about starting a business, especially going into 2021.
Yeah, and look at the date on this article. This was back in May. Now remember, the whole pandemic thing started March, April-ish, somewhere in there. By the time May come along, people are wondering, well, is this a good time to start a company right now? And CNBC, as you can see on their website, has an article on that. We've got a couple of quotes that we've got highlighted here that I'm going to go to. This one, for example, starts out by saying there's a lot of people starting a company in the midst of a global economic crisis. But it's the last thing on their list sometimes. But it may not be such a crazy idea, he says, according to entrepreneurs and startup investors that CNBC spoke with. Now might even be the best time to start thinking about setting up a new venture from home. Now, folks, if you're on this webinar wondering, why am I looking at an opportunity to start a business right here during this whole pandemic thing? This guy says this is a great time to do that. And then he goes on to say that Luke Lang, co-founder of equity crowdfunding platform Crowdcube, says he thinks the virus outbreak could pave the way for new tech ventures focused on healthcare and medicine. What a coincidence, Eric.
Absolutely.
We just happen to be in the one industry that has to do with computers and healthcare. Those are the two biggest booming industries that there are out there.
You bet. And you and I both know that maybe a week from today, we're actually launching a new service here at American Business Systems that has broke out because of the pandemic. Folks, whenever you see what ABS is partnering with and the people that they're partnering with, it blows your mind of what the flexibility that ABS has, and then in the flexibility that gives it to you. And it's just amazing that what we sometimes see, Patrick, and I think you and I we've done hundreds of webinars over the past years, and everything from whether we're going into a one-payer type of system, or when Obamacare kind of finally came out, and then when the pandemic comes out, each of these, what we call disruptions in the marketplace, actually creates brand new opportunities for people that are wanting to break out and do their own ventures.
That's a good way to put it. In fact, this next article is from the New York Times, and this article is headline, "Is a pandemic the right time to start a business?" It just might be.
It just might be.
And the weird thing is, Eric, that you're right. We've gone through the Obamacare thing. We've been through the single payer thing. We've gone through a lot of things over the years. Everything seems to point to this industry being so solid, so inflation proof, so recession proof. It's just like nothing can touch this because it's such an essential thing that we have to have in America. In fact, it's one fifth of the entire gross domestic product is healthcare.
Yeah.
So
yeah.
Good choice for anybody that's looking into it. And then, here's the actual quotation from this article. I think I'm maybe a page or two ahead of you there, Eric. I'm not sure. Let me look here.
You want me to go up a little bit? I can go up. I can go backwards.
Yeah. Okay. Well, here's some of the companies that started during, what you would think of as challenging times, economic times, in what they call downturns. Look at this: Airbnb, we got Disney, General Motors, Hewlett Packard, all these big companies that you've heard of, folks. They all started during the downturn. So maybe the best time to start a business, Eric, is when there's something disruption going on, like you put it, in the economy right now. Yeah, there's a guy that says, I probably wouldn't want to be in a business right now that caters to business travelers. I wouldn't want to be in the airline business,
no.
But I'd love to be in a business that helps enable telemedicine. Look, you'd think we wrote this article, Eric. Here's somebody out of the blue saying, I'd love to be in a business that enables telemedicine. Just happens to be what we're introducing to our licensees.
Yeah, and folks, it's going beyond telemedicine. I mean, obviously, we've all experienced probably some type of telemedicine. Patrick and I are kind of doing a teleconference right here. It's no different than that, except one of us might be the doctor here, but it's what you can do with the devices. Patrick, people are wondering how can I get my vital signs done, and the simplicities of maybe even monitoring blood sugar and making sure all that's done. See, that's what's known in the world that we're working with is virtual care. So it's beyond just telemedicine. It's this whole virtual care that, again, ABS has reached out and looking and assisting and developing. So folks, what you're learning today of how to earn a six-figure income doing billing for doctors, you're probably thinking, well, how am I going to market to doctors? How am I going to get in front of them? Well, you got to get in front of them with things that they're in need of right now. And one of the biggest areas that doctors are in need of is a way in which they can do telemedicine and or virtual care. And ABS is doing that. And then it leads right in for you to do the billing for that virtual care. So we're gonna kind of take you through that. But one of the things is, Patrick, really just getting back down to some of the basics. Why would a doctor even outsource to me? I mean, don't doctors already have their own billers? Don't they already have solutions that, am I coming late to the game? What can you share with everybody right now?
Yeah, I mean, I used to ask that question when my wife started doing medical billing. This was back in the early 90s, Eric. I mean, way back before computer software was even developed like it is nowadays in the cloud. But I used to wonder, why is a doctor paying my wife to do the billing when he's got his own staff in his own office? He's got computers, probably, even back then. They could do their own billing, of course, and some of them do. Some of them still do. But most doctors have realized that outsourcing anything that's not their core competency, their core competency is helping patients to get well and stay well, not doing the billing. That's just kind of a side thing that has to be done for them to get paid, because they got to pull that money out of the insurance companies and out of Medicare. But it can be done by somebody who's a professional. In fact, as this quote shows here from the New England Journal of Medicine, everybody's heard of that. Market analysts estimate that 24 cents out of every dollar is wasted on the administrative and billing expenses. So why would a doctor waste 24 cents out of every dollar doing the billing inside of his own office when he can outsource it to someone else, like the people on this webinar who could be trained to do that for the doctor?
And then here, Patrick, you want to walk through this. This is a great little chart, folks. If you haven't already done this, go over there and print out the handout so that you'll be able to follow this along. Maybe you want to take a few notes on your handout there. And Patrick's going to kind of walk with you and walk you through this particular spreadsheet chart to kind of show you, the advantages of getting the doctor's billing outsourced to somebody like yourself.
Yeah, so it's a real simple chart. In the left side, you see there the first column. Those are the annual costs for physician billing. That was a muted sneeze. Sorry. I know you're supposed to put your elbow up here.
That's it.
Okay,
Yeah.
but I didn't think it would spread through the computer to anybody, so I didn't. All right, so look at the annual cost. Now, what we did is we took 100 claims per week. That's 20 claims a day, basically, that we're just randomly picking that number, about $100 per claim, times 52 weeks. And then we even multiplied by the 8% that the doctor would pay you, attendee. If you become involved in our company, you would get 8% of that. So they'd pay you $31,000 in a year's time for doing those, 100 claims per week. But if they spent the money on their own people inside, let's say they had 1.5 people at $15 an hour, that's $46,000 they would spend just on those employees doing the time. And then there's payroll taxes, workers' comp insurance. Look at all this: errors and omissions insurance, training costs, leave coverage when they take a little time off, employee benefits, hardware, software, IT support. All that adds up, and people don't realize that these are hidden costs behind the scenes. Yes. So it could cost a doctor, what is that number at the bottom? $65,000 a year to do the billing in their own office, in-house. Whereas they outsource it to you, and all they pay is that $31,200 that we talked about earlier. That's based on a percentage of the money that you actually bill and collect for the doctor. So it's a very easy chart to look at. The doctors can see it, and some doctors have looked at this and gone, my goodness, why am I spending that kind of money when I could just be outsourcing it?
And you can even see, because Patrick, a lot of people, I know that we haven't really brought this up many times utilizing this chart, but I think this is something that we can certainly point out here. A lot of people are asking, not on today's webinar, but to have on other webinars, what am I going to charge a doctor? Well, typically, again, Patrick brought up that 6%, but even if you went up to 7 to 8%, you're still seeing that you're going to be up underneath what the doctor is already pushing out right now. So, what we try to tell our licensees here is that anywhere from 6 to 8%, depending upon the type of doctor, and then we're going to help you with that. Our support team actually helps you really zero in on what you're going to charge the doctor based upon what's called a practice analysis. That practice analysis is actually going to help you zero in, but it really won't be anything lower than 6%, but it could be as high as 8%, because you're going to be gathering all these costs here already in that practice analysis. So you're going to be able to know how to balance that out. And our team, plus 26 years of experience, is going to know how to help you get that done. And then plus, Patrick, one of the things that for maybe brand new people that have never known anything about billing, you just think that, hey, I can get the information from the doctor, fill out some paperwork, and send it off. But folks, what you don't understand as well is that there could be some claims that get processed that actually get rejected, either from a clearinghouse or from the insurance companies themselves. And this guy, Dave Jackalow, says, it's not unusual to see rejection rates as high as 35% or even higher. And it takes a lot of extensive and expensive follow-up whenever you got that kind of problem.
Yes, and as you can see, it says it's not unusual to have a 35% or higher claim rejection. Eric, our system, because it's cloud-based and because we have the clearinghouse own the clearinghouse inside of our system, there's no third-party clearinghouse to go through. Ours is less than 2%.
Right.
So, folks, that means more money in the doctor's pocket, but it also means more money for you because, if you collect 98% of the doctor's money versus, say, 70%, that's a whole lot more for you.
Absolutely. All right. And then, again, why will a doctor outsource to you? Again, you can't just walk into that doctor's office and say, hey, I'm the new medical billing. You can't walk in hardly any doctor's office anymore, but we're going to show you the ways in which our licensees are getting inside of doctor's offices. But what you're going to want to end up doing is called this practice analysis. It's kind of like trying to sell something to somebody which they don't even know that they need something.
That's right.
The practice analysis helps get that doctor to discover what's really going on with their practice, pull all those numbers that we showed you in that spreadsheet earlier, and then really do an analysis, Patrick, on, do they have rejected claims? Where do those rejected claims reside? Have they refiled those claims? Are those claims off the table? Did they not? I mean, could they be losing $30,000, $40,000, $50,000 a year in just claims that are not even followed up on? This questionnaire is going to help discover that.
Yeah, we developed this questionnaire over the last 26 years, folks. So it has a lot of information in there that you might not think of on your own. And the great thing is that we walk you through this in our live training, our one-on-one live cloud-based training. We take you through this questionnaire question by question, show you why the question's asked, what answers you can expect to see, and what the real data is behind this question. Remember, there's a reason for every one of these questions that we ask the doctor. Some of the questions the doctor may not know, but believe me, the office manager probably knows most of the answers to most of these things. So a lot of times we'll do this this practice analysis with the office manager. We'll show you how to get those appointments to go through that. And then you take all that data from those pages that you've asked the questions from and the doctor's office, and you go back to your office and plug those into our software, our spreadsheet, basically, that comes up with this report. Now, I think the next slide, Eric, is the one that zooms in. There we go. And as you can see, folks, this is one that we actually created for a doctor. Your eyes probably dropped right down to the bottom, just like everybody else does, to see what was the increased revenue for this doctor. Look, we could increase this particular doctor's revenue by up to $321,000 in a year's time. Eric, most people find that hard to believe, but it's based on the numbers the doctor and their office manager gave us, so we know that they're accurate numbers. Even if that number was twice what it ought to be, if it's way overblown, take half of that. Is that $165,000, $70,000?
Yeah.
Any doctor should be at least willing to look further into this. If you were a doctor, wouldn't you say, maybe I ought to check into this a little bit more carefully and see if there's really that kind of money laying on the table?
And then what we're going to do, we're actually going to add into this practice profile here for this doctor to also include the numbers of the potential additional money that the doctor could be making by adding in virtual care services. And Patrick, we've seen numbers match that number there per month. So imagine you could walk into a doctor's office and say, look, just for me doing your billing, I can increase that $26,000. However, since I'm a revenue cycle management company, I'm going to show you how your practice, if you're not doing a virtual, if you don't have a virtual care strategy in your practice already, I'm going to show you what you're missing. And it could be another $26,000 to $30,000 a month. Now imagine adding that together. That's another $600,000 total that could be added to that practice.
Yeah, and of course, folks, I know it's hard in this webinar for us to go into this in detail. Remember, we have much more time because we take time to go through it in detail with you in our training. But the point is, we want to just show you that this is one of the tools you'll have available to you that we've spent thousands of dollars developing over the years that makes it real simple. The bottom line is the doctor either wants to save money and keep more money in his pocket or her pocket at the end of the year or not. And if they go with you, as you can see, the possibility is that they can increase their revenue by $26,000 a month. And that's before we talk to them about the virtual care. Now, let me just touch on that just for a second, Eric, because every time you talk about this, and I'm anxious to see what you're introducing here in a couple of weeks to our licensees, but folks, this is one of the many, many new things that ABS continues to offer to our licensees. We come up with new offerings, new ways to make money for you and for the doctor, and those are always at no additional cost. Our initial licensing fee of $28,000 is all you pay ever to ABS, because we make money on all of these services on the back end as well. So we're trying to, keep it down to where we don't have to charge you anything for new training, new products, new services. And Eric, we'll be at Star Trek level here soon on that virtual care.
Yeah, that's no doubt. But going back just to increasing the doctor's revenue by doing their billing, folks, that's why we're selling. You don't have to sell anything. Patrick, I mean, do I have to sell you cash? I mean, if I were to say, Patrick, I'm going to show you how you can add $10,000 more a month to your income. I mean, you're going to want to at least say, how can you do that?
You got my attention. Yeah. I'll give you 5 minutes to talk about that.
That's exactly correct. So that's why in our training class, we show you how we're not teaching you how to sell it. We're just teaching you how to do a discovery page like that practice analysis. So Patrick, let's talk about what they'll be doing to earn that money. But it first starts with having the platform. This is the nucleus of how everything works. And Patrick, we're so unique to have so many different unique services, but really does begin with the revenue cycle platform, this iClaim, EMRX, clearinghouse, and patient portal.
Yeah, when my wife started out, of course, Eric, as you know, we had a DVD, a CD that we put in our computer. That was the software for doing the billing for the doctor. And of course, that's very dangerous nowadays because of the HIPAA rules and regulations. You don't want any data stored on your computer in your office.
Right.
Even if you back it up nightly, it can be stolen, it can be hacked. In our cloud-based system, of course, as you know, Eric, for the last 20 years, we've had no problems whatsoever with our data because it's backed up on redundant computer servers on a regular basis. So even if somebody hacked one of ours today, the other ones are there that just switch over, and we automatically, and you'd never know it as a user, you just never know that we lost any data at all. But the great thing is we haven't lost anything because we are following all the rules for the HIPAA compliance. And so let's talk about what this illustrates right here, Eric. What there's a piece of paper. Are we dealing with paper now?
Well, that's what you used to, as you kind of said a while ago, that's kind of what you used to be having to deal with, working in with a paper, and then what you had to do with that particular piece of paper, which is have someone take that information and then type that in there, like you said, and maybe it was on a piece of software, but we've gone even further than that. Now you've got a doctor that can use an iPad, such as what we're showing right here, utilizing the electronic medical records platform, which is not just tied into the iClaim platform, it's actually built inside of the iClaim platform. And then also inside of that, it has its own it has its own clearinghouse inside of that. So not only do you have an EMR system, electronic medical record system, you have a billing practice management system and the clearinghouse. Uh, and that is what's going to take those claims directly to the insurance company. So this is a very, very unique piece of software. So what I would recommend, if you haven't done this, folks, we're at the bottom of the hour, just going to let you know we've got about 30 more minutes, but I want to kind of pitch this to you. If you haven't taken the time to get with one of your sales reps here at ABS and ask them to do a live demonstration of this software, you're missing out on a whole lot. You need to do this, get your mind kind of wrapped around how all of this works. This will be better than what I'm sharing with you right now on the webinar. You're going to be blown away by what this does.
Yeah, it's amazing. And folks, that clearinghouse, by the way, is illustrated there as if it's inside a picture inside of our computer. We did that because usually normal software that's sold out there on the market for doing billing for doctors has to be sent in batches at the end of the day. All the claims that you process have to be sent to in a batch form to a third-party clearinghouse. That's a company that's set up, and all they do is scrub that clean, make sure it's clean, make sure it's going to be processed accurately, and then formatted correctly for all the different insurance companies that are out there. With ours, there is no third party. We take all the blame at our end, and that's why our rejection rate is less than 2%.
Well, so folks, what I'm going to do right now, I'm going to give you a little bit of a screenshot demo, just so that you kind of see what's going on here. So let's say that we logged into the iClaim platform, because I'm going to kind of take you on a tour about what you need to do when you're actually going to do a billing inside of our claim. And Patrick, what is the average time that we hear from our licensees that it takes them to actually do a claim?
If it's a new claim and you have to put in the data for the patient, it might take you 5 minutes. But if it's a repeat visit from that patient, the data's already there. It takes you about what, maybe less than a minute?
Yep, it sure does. So let's go to billing. We're going to go over here where it says enter charges, and we're going to just enter the professional claim charges. And this is what Patrick says. It's basically, we've already kind of got the patient pulled up. We already know that information because either we've typed the patient's name in there and it popped up and it populated in there, or again, it's come directly from the EMR system. Remember that the EMR system is going to have the patient name, all the patient demographics, and then it's going to start pre-populating and loading into your billing system what's called the diagnosis codes. Now there's two types of codes. There's a diagnosis code and then there's a procedure code. And Patrick, I know we're going to get into maybe a little bit about one of the other ancillary services about coding, but you want to kind of go in and tell them that our system already has all the codes and the system actually does the coding for them?
Yes, folks, these codes, by the way, have to do with what's wrong with the patient, the diagnosis codes, they're called, ICD, International Classification of Diseases. And then there's another one that's the CPT codes. These are the actual codes that tell the doctor what the doctor did for the patient, gave them an injection, examined their ear or whatever. So there's codes for all that, thousands of them. And guess what? You don't have to know a thing about any of those codes. You do not have to know coding to do what we teach people to do, which is submit the codes that the doctor has given to you through the system, because as Eric said, all 75,000 codes are all in our system.
Yeah, absolutely. So folks, you can see here that either whether you have to just type those numbers in there or they come in from the EMR system, you're going to be able to put all that in there, run some checks on it and some balances, and then click down here where it says create claim, and folks, you've created a claim. That's basically how easy it is. And us just talking our way through it, I've been kind of watching our time here. It took us about 3 minutes from the time that we started talking, just kind of just discussing this with you through here. It's about 3 to 4 minutes. So you can see that really taking the time on there it doesn't take too long at all.
Yeah, so let's talk about ROI. Everybody's heard that term probably. It stands for return on investment. In other words, when you invest in a business, in our case, the $28,000 licensing fee, for example, that we charge for our training and our lifetime support, that is an investment on your part that you want to get a return on. So let's see how quickly you could get a return on that investment as we go through these examples Eric has come up with for us.
You bet. And so, folks, if you haven't been onto our website and seen this, some of you may have, but I encourage you to go out there, go to our website, right up at the title bar, just click on Income Potential, and then click on Medical Billing Income Calculator. Now, what's already in there, it's going to show you that we've got, in this scenario, we've got one doctor that's seeing about 20 patients a day. They're open 5 days a week, and the charge is 7%. So you can see there, we're about 6% or 7%. We're at 7%. When we hit submit, look what this number does here as we kind of do this. Folks, that's $36,000 a year, $33,000 a month. Now, Patrick, you just mentioned that the income, the investment for ABS is $28,000. It seems
Correct.
like having a doctor within the first year is going to get your return on investment.
Yeah, in fact, we have a lot of licensees who tell us that very thing, Eric, that they just did what we taught them to do. We teach them about a dozen different ways to market this to doctors. And once they've signed up that first client and they see that the revenue from that one doctor could be as much or more than their license fee, they get pretty excited, because at that point, they know that they never pay us another dime ever, and that will only go up as they add more clients.
That's correct. And so what we wanted to do now, folks, is to be transparent for you. And the best way for us to be transparent is just kind of show you how that calculator does work. And so that's what we're going to do. Obviously, we know that one doctor will see an average of 20 patients per day. Now, Patrick, these numbers that we're putting here are about the lowest that we can think of. This would be a very slow doctor. See 20 patients a day and to pay $100 at a doctor's office. I don't know the last time I paid $100 for a visit.
Yeah, so we're being conservative is what he's saying here, because we don't want to blow these numbers out of proportion, folks. And of course, the numbers don't apply to everybody. Every situation is different. You're going to have different doctors with different numbers of patients and different amounts and so forth. But we had to use some numbers, so we tried to make them as round as possible. 20 patients, a day times $100 per patient is $2,000 a day that the doctor is bringing in, theoretically, if he can bill the insurance companies for that per day. Let's see what you could make on that.
Yeah, and if you just took that $2,000 a day times 7%, that's $140 a day for you. Obviously, you can get that. And again, we said for less than 90 minutes a day. That's your earnings. And Patrick, for some people, if you think about that, if you went and got a part-time job at $15 an hour, it's going to take you about 10 hours to get close to that. So maybe 9 hours to get close to that. So, for less than 90 minutes in a day's time, that's not bad for that. And then you take that 140 times 5, that gets you $700 a week times 52, you get the 36,400. It's just that simple. And instead of you having to do the long math of all of that, just go again to our calculator, put in some of those numbers. I think, Patrick, we've done that. What happens if we have 5 doctors? Because I think that's the default that we have in the system right now. Yeah. And this is where it gets fun and exciting. Wouldn't you agree?
Yeah, because without even increasing the number of patients that the practice sees, if you have 5 doctors, and they could all be in the same practice or they could be in different practices, you still can run the numbers here. 7% of an average claim of about $100. You can still do the math, and when you click submit on 5 doctors, look what you come up with. Now it gets interesting, doesn't it?
Yeah, $182,000, $15,000 a month. And again, at that, if you think about it, how long it's going to take you to get that covered, that's going to take you about 6 hours, maybe 7 hours in a day. So if you think about it, less than what you would think about what it would cost you to have to leave your house, drive an hour, hour and a half to a job, do your work, have time for your lunch, drive back home by the time you get home. And now if you're leaving at 5:30, it's already dark at your house by the time you get home. You could have saved about that much time and worked 5 to 6 hours from home.
Eric, I've interviewed, as you know, over 100 licensees over the years that's out there on our YouTube channel. And a lot of those people have said, Patrick, I got my first 5 doctors, within the first year. So folks, these are very realistic numbers. And we do have licensees, by the way, who have not 5 doctors, but 50 doctors.
Yes, absolutely. So you can imagine how quickly that'll turn in from a six-figure income to a seven-figure income pretty doggone quickly.
Now
Because
this is all just based on just the billing, the earnings that you can get,
yes,
from doing the billing for the doctor. But as you know, Eric, we've talked about the other ancillary services that we've come up with over the years that the licensees can also offer to the doctors, all optional, of course. You don't have to offer any of these. But with each one of these extra multiple streams of income, we call it, you can earn even more money. So we'll go through that just real briefly.
yeah. So what we've done, instead of trying to say, hey, you can get all of these, all doctors on every single one of these, we took let's say that you did end up with five doctors, and then we've taken some of the most highly used ones that we see happen with these ancillary services. Now, times are changing. Again, telehealth is increasing. Some of the other services that ABS is bringing on board is going to increase. And so as time goes on, we may change some of this. But what we've seen from history is what we're going to be showing you right now. And so the first one that we want to tell you about is called Quick Collect, because Patrick, every doctor has some past due accounts with patients.
Yes, and they hate turning that over, of course, to a collection agency. The patients don't like that, of course, and the doctors don't like it either. But folks, we've used this illustration here because even though this is completely automated and you don't do any collecting, you don't make any phone calls, you don't send out any letters yourself, this is all automatically collecting those past due accounts from the patients and brings in 3 times what the typical collection agency would normally collect. So it's a tremendous online cloud-based service that can mount up pretty fast. This is what I call mailbox money here, Eric. $10,800 just with 5 doctors doing 24 accounts per month. Believe me,
Yeah,
there's a whole lot more accounts that need collecting than that per month in a doctor's office. But
yeah.
we've done the math there for you. You can download the printout here and kind of do it yourself to see how we came up with that. But there's another $10,800. And Eric, once they've got this set up for the doctor, they don't really do a whole lot here themselves. The licensees don't hardly do anything for this money. That's why I call it mailbox money. You just go to your mailbox and see it's there. Maybe it's a check, or maybe you go to your bank account online and see that it's been put in there for you.
Yeah, and so folks, again, Patrick made a great point. If you haven't downloaded that handout yet, go get it, download it so that you can go back and track this, and you can do that. I love that. The Audit Guard. Audit Guard is now going to start talking with you about the codes. And Patrick, even though that people don't come in here learning how to be a coder, because there is a difference between a medical biller and a coder, and there's even a difference between a revenue cycle management company and a medical biller. That's different than a medical coder. Folks, what you are as a certified medical revenue management company, you have at the access of your fingertips both the billing and coders that are, or what's called certified professional coders. These are the people that are going to help you with this service called Audit Guard, this one and the following one they're going to show you. But Patrick, we know that any doctor could be under any type of audit, whether it's Medicare or some of the other commercial payers at any given time. And this Audit Guard is like a preventative maintenance type of thing to make sure that the doctors are staying within the scope of what they need to do. And if they did this, seeing this kind of number added to that 10,000, this could add up to another 18,000 just on this one service.
Yeah, and again, once it's set up, there's not anything that the office, the licensee, we call them, our business owners, people like yourselves that have joined us and gone through our training, they don't do anything for this. This Audit Guard is done by the certified medical coders that we have on staff to do this for you. But you earn money from it, which is a nice thing because again, there's more mailbox money right there, another 18,000 a year.
Absolutely. Then AutoCard is a great service in which you're able to keep at the top of the mind of those doctors. Now, not only yourself, but the doctors, guess what? They need to keep themselves at the top of the mind of their patients. Remember, patients aren't going to the doctor as much as they used to. I mean, it's hard to get into the doctor's office. And so, Patrick, this is a service which the doctors can communicate to their patients outside of social media. I mean, go figure that. I mean, they actually get a card in the mail. And I'm telling you what, anybody that gets a card in the mail, you feel special.
Yeah, you open that up, don't you? It could be a birthday card with $5 in it. So you don't throw away those cards when they come in the mail and look like a greeting card. So folks, this is an automated service though. You're not doing anything on your printer at home. You're not mailing anything out from your house. This is all a cloud-based system that's totally automated that does the follow-up for the doctors to their patients automatically. And you can use it, of course, to do your automatic marketing to doctors as well. We go through that in detail in the training. But look at the kind of money that could be made with this. If you just had 5 doctors on this, each with just 200 patients on the AutoCard system, you'd be mailing out about 1,000 cards per month to those patients, and you earn about $1 per card or $1,000 a month.
Yeah. So there's $12,000 a year in just that.
I think we're paused.
Yeah. Oh,
Yeah.
you think we're paused? So okay, yep, you're right. I did pause that there just for a second. There you go.
There it is. So there's more Mailbox Money. Okay, we're going through these really quickly, folks, so you can do the math on your own if you download the handouts. But let's look at iBox now. Every doctor has to keep their records, all of their records for each patient for a minimum of 7 years. That's the law. This service allows you to offer a secure cloud-based storage solution that's 100% HIPAA compliant. And folks, this is not something like Dropbox or the iCloud. This is way beyond that. This is a true document management system. Trust us that you will want to use this yourself. We do here at ABS, and all of our licensees use it as well. But once you get the doctor on this, you can make another $6,000 a year just because of the money that's there from this service alone.
Absolutely. And there's another, like Patrick is saying, another $6,000 a year just in the service of iDocs now. And again, folks, this is all hands off. Once you get the doctors signed up on these things, they're all hands off. So whether you're doing some coding help, some auditing, the AutoCard part of it, the iDocs now, whatever it is, I mean, you've got, lastly, I think CodeRight, which is a service for coding. So this is the ongoing coding. So if you got a doctor that needs some help with some coding, again, with this is another $12,000 a month. Patrick, it seems like these numbers are adding up pretty nicely so far.
Yeah, I'd say when we get all these services together, assuming you had 5 doctors on these services, just these 5, and you were doing their medical billing, you'd see that you'd be making about, where's that number? Look at this. Here it comes with fireworks.
It's coming.
Yeah, it's a lot. Wow, I didn't know it was that slow. There it is. $250,000 almost. Now, folks, what other home-based business with an investment less than 30 grand can you get into that has this kind of potential? I don't know of one, Eric. Honestly, I do not know, and I know a lot about franchises and business opportunities that are out there.
Yes, I mean that was a pretty doggone big number there. And again, with that that investment of about $28,000, folks. I mean, if you think about it, even if you just did this with 2 doctors, you can still see you not only do you have your return on your investment, but you're in the money, and that's what you want to be able to look at as you're kind of going through that. Now, we did go out there and just say, hey, what about the growth of 10 doctors out there? And again, this is just on the billing. So we went ahead and adjusted these numbers just a little bit. We've got 10 doctors, and we went ahead and added more patients, but we dropped the percentage here of this. And now you can see that you're at, just with the billing with the 10 doctors there, you're at $390,000 a month, $32,000 a month. So Patrick, again, or $390,000 a year, with $32,000 a month in income. So, Patrick, as people are thinking about their future, and I think we just now need to talk to folks here, because we're coming at the end of 2020. For a lot of people, 2020 has been a very difficult year. You're trying to make decisions based upon the election now. Whether your candidate won or lost, it doesn't matter. There's going to be a change. You're going into 2021. The doctors know that they're going to be a change. Now's a great time to be investing in yourself, looking for the future, and then also trying to see what the opportunities are going into 2021. And Patrick, there's not really a better time than now And I think we still have opportunities to get some people through training before the end of the year.
Yeah, because doctors are ready at the beginning of each year, they look back and they regret what they didn't do the previous year. So, folks, if you'd like to give them the possibility, the hope that there is a way to earn more money in their practice, you have the solution. This is like selling popsicles in the Sahara Desert, Eric. I mean, it's that easy when you show doctors. I'm talking about not selling you something, Dr. Jones, but bringing more income, more revenue into your practice.
Yes.
That is an attention getter, and we just happen to know how to do that too.
You bet. Now, I mentioned the live online training, and this is limited, and we only have, I bet you, just a few slots between now and the end of the year. And I know that you're willing to squeeze in a few more if you need to, Patrick, but now's really the time is if they've gotten all of their paperwork reviewed, and we're going to kind of go through some of the steps here, but this is a first come, first serve type of live online training.
Well, and it is limited because we only have a certain number of instructors, of course, that can handle these. Since they're done one-on-one with people, Eric, we're investing 15 to 20 hours with each one of our new licensees. I mean, one-on-one, there's nobody else in the class but you. It's you and that one instructor that you are able to talk with and interact with on every one of the modules. These are all done online through the cloud. And yes, we have a whole series of instructors and coaches that are out there that are ready to take, people by the hand and lead them to success in this business. Now, folks, we happen to know from all these people that you see right here, for example, that all of these people have proven that they've been very successful in this business. Some of them bringing in multiples of some of the numbers we've talked about today. Eric, I can think of 2 or 3 people there that are just done fantastic. And so if you want to be taught by somebody who's actually gone through our training, started their business, they've learned how to build a business, and they're really still out there doing it on a day-to-day basis. We're the only company that I know of that has those kinds of instructors available. So get your place in line as quickly as you can, because Eric, really, there's only this is November 11th. It's only a couple of months now, and the year's over. And so that's what you want to do, is get all your groundwork done. Let's get all the necessary things done to set up your website, get your business cards printed. That takes time, folks. Don't wait until after the first of the year. If you're hesitating to move forward because you don't know what's going to happen, let me just reassure you by saying this: no matter what happens with a new administration or an old administration, it doesn't matter. As long as there's human beings that get sick, they go to the doctor has to get paid. Somebody has to bill somebody for the doctor to get paid. That's you. That's why this business is as solid as a rock. It's not going anywhere.
Absolutely. Now, folks, we've got about 9 minutes left here. So if you got any last minute questions, I want to encourage you to type those in. Patrick, as we're maybe looking for some questions here to kind of wrap up here this afternoon, I know one of the things that we all pride ourselves on here at American Business Systems is the money back guarantee. Why don't you share with that? And then we'll kind of go through some steps of what they may want to do next.
Eric, I had somebody last week say, Mr. Phillips, I just want you to know, it sounds like you've got a great opportunity here, but I don't believe that your money back guarantee is real. They said that to me. And I said, well, one way you could prove that, of course, is to go through our training and then ask for your money back. I said, I've got people that I could give you contact information for if you wanted to call them and say, here's what they did. They invested in the business, they went through the training, and then they asked for their money back, and we sent them a check, every penny of their money back. Now, how can we do that, folks? It's because it happens so rarely. I mean, literally, Eric, as you know, over the years, a handful of people have asked for their money back. Less than 1% maybe of the people who've gone through our training. That tells you we've got something that's real. And all of those people had real reasons why they didn't want to continue on, but it doesn't really matter. You could just say, you know what, I just don't like the way Eric looks. You know, that outfit, he looks like he's a vampire or something. What is with that black outfit? I don't get it. But the point is, it's very, very scary looking. And I don't like Eric. That'd be a good reason to get your money back. It does not matter what the reason is. We literally offer a 100% money back guarantee. Now, Eric, I don't know of any other company in this industry that does that. There's no franchise or business opportunity I know of that charges some sort of fee up front and then says, you know what, if you don't like what we've got in the first 30 days, we'll give you all your money back. I just don't know of anybody who does that. but
Yeah.
we have found that that just works for us because, well, we do what we say we're going to do. Okay, let's give them the steps they need to go through, Eric, to
Absolutely.
get
Let's
started.
kind of start off with that. The first step is just to do some research. Get that research guide. You know, that's a downloadable piece of information that you can look over, and you know, just get that going there. But the next one is browse through our YouTube channel. Patrick and I literally, along with Adam and all the interviews, we've done literally hundreds of webinars that for you to be able to go through. Patrick, do you have that that downloadable research guide?
I thought I did.
That's okay.
Oh, here it is. I'm sorry, I grabbed something else. This is it right here. This is the 50-page guide that he's talking about. Now, I've actually printed it out here, but folks, I just wanted to give you a preview of this. Look at what you're missing. You do not have the data that's in this guide unless you ask for this. Ask for it. There's the phone number on the screen. If you're not sure who your ABS rep is, just call that number right now and say, I don't know who my rep is, but I want that guide. We'll get that to you.
There you go. All right. So browse through our YouTube. That's youtube.com/YABS. This actually webinar will be up there in the next 24 to 48 hours. And then, Patrick, you've got a whole list of people as references. I mean, why wouldn't anybody want to take a look and start reviewing that?
Yeah, these are people who've been through our training. Some of them, we just showed pictures of some of those folks, but you can actually ask for that list from your ABS rep, and it gives their phone number, their email address. You can contact them, folks, and ask them all the questions you want. We don't tell them what to answer. These are real people who are really running their business, and they'll give you the opportunity to ask them all the questions you want. So that'd be the first thing I'd want to do. Don't believe what Eric says. Don't believe what Patrick says. Just believe what other people who've actually invested their money, done their due diligence that you're doing now, and have proven to themselves that it's something that's worth getting into.
Yeah, you bet. And then, folks, I've already mentioned to you about asking for a live demo of the system. So that's part of your steps to success. If you haven't done that yet, you're again shortchanging yourself. And then lastly, lock in your first live online training. Now that kind of goes along with a question that here I'm gonna skip one question and come right back to it. But Rochelle is asking, can we choose our hours for training? So you want to answer that question here real quickly, Patrick?
Yes, Rachel, that's based on the availability of our instructors. And since we want you to have the same instructor for all 8 modules that you're going to go through, we want you to work out your schedule with that instructor, and they will work any way they need to make sure it fits your personal schedule. So yes, you choose the hours for the training, you choose the days, all based on what you and the instructor agree upon when we first put you in contact with the instructor. So that is something that is always adaptable to you. Again, that's based on availability though. So get your due diligence and your paperwork done as quickly as possible so that you have the choice that you want for that.
Folks, give us a call here, 866-565-8413, and talk with us. We'll be happy to help answer all of your questions.